First, let me tell you, I cannot wait to see you. You're the treasure I've been waiting for. Do you know how much I really need you? And I pray for the day when I can finally kiss you. You know, say every day I pray for you. In my heart, there's a permanent place for you. That's why my heart to the beat like do care. Then now you are think so I am familiar. I sing for you and I be like do care. Now you I will choose oh I am familiar. I was singing that song because it's perfect for what I'm about to talk about, okay? It's all about the NICU, all right? That song is all about a mother's love for her child and preparing to bring her child into the world. So as you all know, when someone is pregnant, you think about, wow, this is like the happiest time of my life. For some people though, because pregnancy could come in different forms for people. And for most people, it's the most wonderful time of their lives. Depend on whatever it is, you know, their fertility struggle is. So it could be different for most people. So for a lot of people, this is something that they've always wanted. This is something that they've prayed for. And that's what that song is about. Prayed for this child and now you're pregnant with this child. You're so excited. You started the planning for your child's arrival. And then for most mothers, it doesn't always, you know, go as planned. Then, you know, complications may happen and then the baby might be born early. Most of the complications could either be heart problem like hypertension, or it could be diabetes. It could be, you know, a whole lot of issues that can go wrong when you're pregnant or sometimes just during the delivery. Okay, so this is when this happens for some moms. If it happens way earlier on in the pregnancy, then they might have the baby very early, which means the baby is premature. So this is when the NICU comes in. NICU is for Neonatal Intensive Care Unit. So the NICU is a place that is designated to care for babies that are born prematurely or sometimes term babies that are struggling with medical issues, or just maybe they cannot eat, or they're just not able to be with mom at the time of birth, depending on maybe delivery complications or whatever the case may be. It can be different levels. So you have from level 4, meaning the highest level of acuity, and most of these areas can accept patients from like 23 weeks old all the way to term babies. So level 3 is similar, but the only difference with level 3 and level 4, sometimes level 4 designated hospitals do things like ECMO and take care of other medically complex situations that maybe a level 3 in other hospitals cannot do. So, and then you have level 2, of course, which will mostly be kids that are a little bit stable but still are not ready to be able to go home with mom. So when you're a NICU nurse, you get to you can take care of the tiniest babies all the way to a little more stable or term babies. So when babies are born mostly less than 37 weeks old, they're considered premature. And there are babies that can be born greater than 37 weeks that still needs to be in the NICU. If they are like infant of a diabetic mom, they may struggle with like their blood sugars, they may be hypoglycemic, so they may go to the NICU. Kids that are suffering from heart issues, kids that are having breathing difficulties, kids that have birth defects. So all these kids can be in the NICU. And if you're the NICU nurse, you get to take care of kids from a whole wide range of medical issues, okay? So to work in the NICU, you first of all need to be a graduate nurse. You have most hospitals now hire only if you have like your bachelor's degree. There are hospitals now that will hire graduate nurses and they will train you, and you will, I don't know if they have like a requirement as to if you have to stay there for a number of years. I didn't start the NICU as a new nurse. I went in as an experienced nurse, not experienced in NICU, but experienced in other specialties. So it depends on what hospital you're trying to get into. That's what you need. And as a NICU nurse, you carry orders from the doctors. You do assessments, you do admissions, you take care of these babies, you support the families, and that's basically what you do. So a lot of the babies, when they're born and they come into the NICU, they are, if they're like 23 weekers or so, they will mostly be in the isolate, because most of these kids cannot really survive outside of the womb. So the isolate, which is like an incubator, kind of simulates, you know, the uterus, and sometimes the kids can get humidification to just keep them nice and moist in there until they're fully ready to be outside, and they can slowly wean them off. Other babies can be in the radiant warmer, and then most of other babies can just be in a regular crib. It depends on what is going on with the baby. So the length of stay for babies in the NICU actually solely depends on what the child's problem is. So every kid in the NICU is treated on an individual basis. So it depends on how many weeks that baby was born, how well the baby is doing, what the baby needs, what medical care the baby needs, and what the prognosis are for that child. Some kids may be born very early, like 24, 25 weeks. They may do better than other babies that are born around that same week. So it solely depends. Some kids are born very early, they get intubated for a very long time. Other babies might just be intubated for a very short period. So as I said, it's all individualized. So it depends on what is going on with this child that determines what kind of care they're going to get. Okay? So who do you work with in the NICU? You work with the neonatologists, the NNPs, the neonatal nurse practitioners. You may work with residents, fellows, depends on what if the hospital is a teaching hospital, you may work with a lot of residents. And you of course work with your fellow nurses, you work with respiratory therapists, you may work with the dietitians. They are responsible for the feedings of these babies. And you may work with child life specialists. You will work with discharge planners. Social workers are amazing. They help our families make sure they navigate through, you know, the whole system of getting support. And you may also work with pediatricians, surgeons. You will work with occupational therapists, and this is just to name a few. If you're a NICU nurse, besides just taking care of the babies, you want to be able to support the families. It's very, very important. Some of these family members have been through so much to get to where they are with their kids. Some of them conceived this child via IVF, in vitro fertilization. So they have been through so much. They have spent a lot of money, and then here comes the child that's struggling to survive. So what we do is mostly just give them the support that they need and reassure them that we are here for you, we are here for your child, we're going to do our very best. We don't make promises because no one really knows what's going to happen, but just support them and let them know that you are there. You don't want to be, you don't want to be that nurse that takes everything personal, because you don't know the story of these families, of these parents. Sometimes they may come in, you don't know what news they got from the doctor, because even though you're the bedside nurse, a lot of times you don't really know everything that is going on. You might listen in on rounds sometimes, but there are things that they may say to that parent that you're not fully aware of. So you don't want to take things personally and just, let it out on families when they come at the bedside. I mean, don't get me wrong. Pediatric care, NICU care, just working with families alone, sometimes even in the adult setting, it's not easy, okay? Just being in this field and dealing with people, it's not easy, period. But you need that special patience and stuff when you work in like NICU. You're dealing with delicate babies, very complex medical issues, and these moms have the fear of the unknown. They come in every day hoping that when they come in, that child is still there waiting for them. They have so much love in their hearts. I mean, there are, other people who have kids and they don't really know what to do with this child, and that's a different story. This is when social work comes in and they might find placement for these children, whether it's by foster care or adoption. And you have other babies that are in the NICU whose parents are suffering from maybe addiction, whether it's drugs or whatever the case may be. So we have all these type of kids. So you just need to know how to deal with these families, okay? Working in the NICU, it depends on what facility you're in. You're going to get a lot of support. You're going to get continuous education, which will keep you up to date with whatever is going on, whatever skills that you need. So the nurse educators are excellent, at least at the job that I was at. The nurse educators are excellent. The managers are great. They will, make sure they coordinate everything in terms of education. So we used to do like quarterly education where we will do a whole bunch of modules, and then we will also have days where we practice our skills to just keep up to date with what is going on. If it's a new equipment, we will learn how to use it. If it's a new skill, we will learn how to do it. So you don't have to worry about that. Depends on where you work at. You will get all this extra support to make you a better NICU nurse, okay? So you also will need what they call NRP, but don't worry about that. Your job will arrange for you to get this. Some jobs will require you to have it before you get hired. Other jobs will let you get it on the job once you start working. It's like a like BLS or ACLS, but it's for neonates. So you will get trained. This is just to provide care or resuscitation. The NICU team will go to labor and delivery for deliveries. They will be called in, depends on what baby they're expecting. So if it's a premature baby or baby that's just they suspect maybe might be born with complications. Sometimes if the baby is breech, they might be called in. They might also be called in sometimes for twin deliveries. It depends on what is going on, but this is a call that OB will make, the obstetricians will make. And we have transition care nurses that also can make that call to NICU and let them know if they need to be at delivery. So they will come in during the delivery and do what they have to do. Then if the baby needs to be taken to the NICU for further management, then the baby will definitely go to the NICU. If the baby is stable enough to stay with mom, then they will let baby stay at the bedside with mom, okay? But a lot of hospitals do not allow every nurse to go for deliveries. So I know at the hospital where I worked at, the transport team, which is like nurses who have gotten more training in like doing stuff like they do peak lines, they do a whole lot of advanced skills that the regular bedside nurse cannot do or doesn't do. And they will go into labor and delivery, and they will transport the patients to the NICU, and the charge nurse will also go. And I know the whole NICU team, if it's the NNP, the neonatologist, or whoever is on for that day or night, will also go. So just find out if you want to work in the NICU, or once you get hired into the NICU, you can find out whether every nurse goes for delivery or if it's just designated people that go for deliveries, okay? But the NICU is a great place to work. If one of the programs that's really good to support NICU families is the March of Dimes. So they usually have like a walk every year, and I think it's usually in April. So this program helps do research. They advocate for like healthy moms and babies, and they also educate families on, if you're a NICU mom, how, where you can get support groups, things that you can do, where you can find resources to help you. So I always wanted to do it, and finally when I got into the NICU one year, I got the chance to, do it, and some of my coworkers were also there, and I did it really for a friend that had lost a baby, and I did it in support of that child, and also just by being a NICU nurse, and also for all the NICU moms, because I know the struggle that they go through. I enjoyed my time at the NICU. I loved every minute spent there, as I have a special place in my heart that I will always, always, always remember. All these families that I met, wonderful families, and all these babies that I got to, be a part of their journey. And I think about them all the time, and I just imagine and, wonder how they're doing, and, how they're growing. I am in touch with some of the families, and sometimes they send me pictures, and I treasure these moments when I see them and just see how, remember their journey from how far they've come and to where they are now, from laying in that tiny bed with their tiny selves struggling to survive, to now walking, to now running, to now celebrating birthdays. It just means so much, and I am so glad I got to be a part of that and got to share my story when I see NICU moms or moms that are, struggling with this. I get to give them, a little bit of my knowledge and experience that I was able to get from that. So if you're thinking about NICU, it's definitely worth it. Go for it, and you can do it. I know most people are scared of taking care of tiny babies, but you can choose to, work in like a lower level, maybe a level 2. I hope you enjoyed watching this video. Please like it, and share if you know someone that will benefit from this video. And if you're a NICU mom watching this, stay strong. I hope you whatever it is that's going on with your child or went on with your child, I hope they're doing well. And if you have a kid currently in the NICU, stay strong. Okay, the nurses are excellent. They're taking very good care of your child. They know how much you love that kid. They know how worried you are once you leave that bedside and turn your back to walk out that door, and you're concerned, how is your kid going to do? We got you. All right. The nurses are excellent. They do take very good care of these kids. I know that because I was once there. So I am letting you know, be rest assured that we know what it is to, have that child and go home every day without that child. All right, so thank you so much again, guys, for supporting my channel. Please continue to watch for more videos and let me know in the comments below. And if you're an experienced NICU nurse already, you can also, you know, drop some stuff in the comments below and just let me know what you think. And if you're a nursing student, you want me to do a video on any topic, just feel free to also, you know, drop it down and see if we can, you know, get to some of those. But thank you for watching. I really appreciate it. God bless you. Bye.